Bacterial vaginosis, Madison Merritt. Understanding STDs. What is an STD? An STD, also known as a sexually transmitted disease, is an infection that is passed from one person to another through sexual contact. STDs can be caused by various things such as bacteria, viruses, and even parasites. Why is it so important to understand STDs? It is extremely important to be well educated on STDs, as it is crucial for protecting not only your health, but the health of any sexual partners you may ever come across. Many STDs can result in severe medical consequences. These can include infertility issues, cancer, chronic pain, difficulty during pregnancy, and in some cases, even death. Bacterial vaginosis. So what is bacterial vaginosis? Bacterial vaginosis, more commonly known as BV, is a vaginal infection. It is characterized by an imbalance in the bacteria that normally live in the vagina. Lactobacilli are a type of bacteria that usually live in the vagina. In individuals with bacterial vaginosis, the amount of lactobacilli are decreased, while the number of the bad bacteria harboring in the vagina is increased. This makes your vagina less acidic and reduces its natural defense against infections. While BV is not technically considered an STI, it can definitely make you more susceptible to gaining STIs. Studies have shown that individuals with bacterial vaginosis are more susceptible to STDs like chlamydia, gonorrhea, and HIV. In some studies, I heard them call it the precursor to STIs. What is the definition of BV? BV is a common vaginal infection caused by an imbalance of bacteria that would normally live in the vagina. What are the causes of BV and the modes of transmission? BV is a result of an imbalance of good and bad bacteria in the vagina. While professionals do not know the exact cause of BV, it is said that douching, using bad condoms, or reusing old condoms, having new or multiple sex partners, and poor hygiene can all upset the normal balance of the vaginal bacteria. This increases your risk of obtaining BV. Bacterial vaginosis is not always transmitted through sex, however, it is the main transmission form. Men are not able to get BV, however, they do carry the bacteria that causes it. Bacterial vaginosis can only be transmitted through vaginal sex or oral genitalial contact with the vagina. It is a lot more common in individuals who do have multiple sex partners. The bacteria of BV is usually found in the vaginal fluids, which is what is being transmitted during intercourse. Prevalence and demographics affected by BV. Global prevalence. Bacterial vaginosis is a fairly common infection. BV has a global prevalence of 23 to 29% of women in the reproductive ages who are carrying BV. Women between the ages of 15 and 44 are most commonly found carrying BV. It is also said that BV is more commonly found in African American and Hispanic women rather than Caucasian and Asian women. BV is usually more common in women who work more labor-intensive jobs, such as farming, construction workers, and truck drivers. I think not only is this due to the labor in their work, but also the uniforms they have to wear, such as farming. You usually are wearing overalls, and construction workers, sometimes they're wearing FR suits and coveralls. This makes it less breathable down there, and I think that can make it easier for your vagina to harbor those bad bacteria due to all the sweat and the lack of air down there. Prematurity has been frequently associated with BV, which is first-time pregnancies. You are usually more susceptible to BV. Bacterial vaginosis is also linked to premature pregnancies as well as low birth weight. IUD has been greatly associated with the risk of BV. IUD is a form of contraception. It is inserted into the cervix, and it is said that this can harbor a lot of bad bacteria, which can thus make you more susceptible to obtaining BV. Symptoms of BV. If you have BV, you may experience discharge changes. Your discharge may be thin, grayish toned. It can also be a milky whitish tone, and it will have a fishy odor. The smell may become stronger after intercourse or menstruation. Some women may even experience having an increased an increased amount of discharge than they would normally experience. There is sometimes an itching and burning sensation. While it's not always present, a lot of women may experience vaginal itching, burning, and even pain while urinating. Complications of BV: increased risk of STIs. BV can contribute to the risk of acquiring other STIs such as chlamydia, gonorrhea, herpes, and HIV. Pelvic inflammatory disease. This can also come along with BV. This is an infection of your reproductive organs. PID can lead to ectopic pregnancies and even infertility issues later down the line. BV can also cause pregnancy complications. During pregnancy, bacterial vaginosis has been linked to preterm birth, low birth weight, and increased risk of infection during the actual delivery process. Methods for diagnosis. Bacterial vaginosis is typically diagnosed using a combination of clinical examination and laboratory testing. Using a microscope is the usual standard method. Doctors will take a vaginal swab, and from there they will then examine your discharge under a microscope. They are looking for clue cells. These are cells that are covered in the bad bacteria. Other tests may include measuring the pH of your vagina or the whiff test, which is a test to check for a fishy odor after adding potassium hydroxide, which will basically enhance the fishy odor that is already present. Importance of early detection. Early detection of bacterial vaginosis is crucial for your health, especially if you ever plan to become pregnant. Leaving BV untreated can lead to an abundance of health problems later down the road, including increased risk of acquiring other STIs, pelvic inflammatory disease. Again, it can also cause premature pregnancies and low birth weight for the baby. Accessibility of testing options. Testing for bacterial vaginosis is generally pretty accessible, while older methods such as the microscope method can be a little bit harder to receive. Newer methods such as clinical criteria, laboratory testing, and point of care are much easier to receive. You can usually receive them from an OBGYN or even just your clinic that you regularly see. These newer methods of testing offer the same accurability with the advantages of easy use. You can even go to your local pharmacy and get an over-the-counter pH test if you are worried that you might have BV. Treatment options. Bacterial vaginosis is typically treated with antibiotics. The two most common ones include clindamycin and metronidazole. These antibiotics are available in oral forms, in a pill form, and also a vaginal form, which is going to come in the form of a gel that you will just put onto the vagina. In addition to these antibiotics, it is also encouraged that you take probiotics to help treat your BV. This can help maintain a healthy vagina after BV and potentially prevent BV in the future. It is extremely crucial to take all of the antibiotics you have been given, even if your symptoms seem to have gotten better before you take all the antibiotics. It is still recommended that you take all the antibiotics given to you. Challenges in treating BV. While treating bacterial vaginosis, you can run into many challenges. BV has a high rate of reoccurrence. Most women who have had BV will usually relapse within 3 to 6 months. It is said that 52 people who have had BV will have it more than one time. This is because it's very difficult to reestablish a healthy ecosystem in the vagina after having BV. You can also potentially run into the issue of biofilm formation. The bacteria associated with bacterial vaginosis are able to form biofilms. This biofilm protects them from the antibiotics, basically making them resistant to the treatment. How can I prevent BV? Preventing BV involves maintaining vaginal health and reducing the factors that may upset the natural balance of your vaginal bacteria. You should avoid irritants, avoid using douches, scented tampons, pads, and vaginal soaps. All of those things can disrupt the natural pH of your vagina. Use protection. Consistent use of condoms can vastly decrease your chances of getting BV, especially for those who have multiple sex partners. You should practice good hygiene. It's extremely important to keep your vagina clean. Gently washing your genitals with a non-scented soap and water will keep you clean and less susceptible to harboring bad bacteria in your vagina. Consider taking probiotics. Probiotics may help you to restore and maintain a healthy vagina and potentially prevent BV in the future. Stigma surrounding BV. There is a lot of stigma and shame surrounding BV. This can significantly affect a woman's life, especially while dealing with bacterial vaginosis. This stigma can lead to feelings of low self-esteem, anxiety, and can even lead to difficulty in sexual and social relationships. These feelings often cause women to avoid seeking treatment for their BV due to the shame and embarrassment they feel. They would rather keep their bacterial vaginosis hidden than speak out and seek treatment for their BV. Importance of education. It is so extremely important to educate yourself on the results and causes of BV. Leaving BV untreated can lead to many health problems later down the road and may even affect your ability to have children one day. By educating yourself, you can reduce the risk of obtaining other STIs. By educating yourself, you can reduce the risk of obtaining other STIs and improving your chances of healthy pregnancies. Conclusion. The main thing I want you to take away from this presentation is while the STI, in this case, BV, may not seem like a big deal, it most definitely is. While BV may seem like a mild infection, it can lead to so many terrible outcomes. It is so important to be educated on your body and the STIs you may be susceptible to. It is crucial for maintaining your health and even your partner's health. I encourage everyone to educate themselves on STDs, learn how to prevent them, get regularly tested for them, and lessen the stigma around STIs so that other people feel comfortable speaking out. I will now open this section up to questions. Since I was unable to attend class, I had a few family members ask me a couple questions. How long does it take for BV symptoms to show? The time in which you can start to see symptoms can vary. However, women say within the first 30 days, you usually will start to recognize those BV symptoms. Can BV affect other parts of your body besides your vagina? Yes, unfortunately, if it is left untreated, BV can spread to your reproductive organs, and this is where it will lead to pelvic inflammatory disease. Can BV make you sick? From what I saw in most common cases, you really don't experience like any physical sickness. It's usually just the common symptoms such as itching, odor, burning, and uncanny vaginal discharge. However, in some cases, I did see that BV caused other symptoms in the body like nausea, vomiting, diarrhea, headaches, and even dry mouth. These are the resources I use for these presentations. Thank you so much for giving me your time today and listening to my presentation.